Hello everybody. We have now confirmed the experience, the thrilling experience of becoming a mother. Now, what care should I take throughout my journey is the next question. Foremost, think you are absolutely normal and you are carrying another pretty soul inside your body. Why I am saying is, you should feel happy every day. The mood swings should be totally avoided. I am telling mood swings because, as I told you in early pregnancy, people can have vomiting, excessive sleepiness, a hatred towards certain items of food, activity, feeling sleepy, dull. All this can be overcome by simple exercises, a good diet. First and foremost is eat well and sleep well throughout your pregnancy. I mean, eat well is a nutritious diet. The nutrition should be in such a way that you like the food. At the same time, it contains, as I told you, enough proteins, carbohydrates, and most important, vitamins. There is no point in just carrying a long prescription from the doctor. You try to take whatever food you take in a balanced way. You can separate the items. You need not take, suppose for example, you don't like morning coffee or tea. You can start a day with a fresh fruit juice. Sometimes, due to excessive vomiting, some people develop heartburn. That is, they feel retching and burning sensation. This heartburn can be avoided by correct posture and slowly taking bland diet. Sips of fluids, sitting up, relaxing, and even listening to a music, the nausea goes down and you need not feel worried about the heartburn. This is the regurgitation which occurs in people who vomit frequently. Again, backache. Many people think as soon as they become pregnant, there is backache, all the joints are paining. It is not that way. The hormones called relaxin is secreted during pregnancy, which loosens the pelvic bones. This is to accommodate the baby during delivery, and throughout pregnancy it stretches. This, in some women, they are very sensitive and they experience it as backache. Low backache is not a common problem with pregnant women alone. It can occur in anybody, especially the working women. Backache is becoming a problem. So correct posture, sit up well even you are working or when you are reading a book or when you are eating. Posture is very important. The back curve should be straight. Similarly, with the change in lifestyle, we never squat. The previous, what do we call it as Indian type of lavatory where people used to squat, it was a very good exercise. Now we are switched over to Western lifestyle toiletry where we sit like a chair. So there are some exercises which we now advise because from childhood you are studying, not all are privileged to do active exercises. Then they are concentrating on the career, and what they have is maybe obesity, tension, and in some people hypothyroidism also. So to correct yourself in early pregnancy itself, if you do not have any complication, start doing exercises. I will show you by visuals simple exercises. First, squatting on the floor. Then put your hands forwards and then your legs backward and try to push up your neck forward. Then, like cycling, you do the exercise on your toes and try to stretch your feet. Similarly, this applies to applying pressure on the wall with both your hands so that you are applying equal pressure. This exercises your oxygen consumption. You take deep breaths. You can raise your legs while you do that. Take the deep breaths and leave it slowly down. Another exercise is not only squatting, you try to touch your toes. This helps by crossing the legs and touching the toes. The flexibility of the body becomes very well. Sitting in the chair, you can practice some exercises. Similarly, these exercises should be done when you are feeling fresh in an open space. You consume more oxygen and you can play a music so that you enjoy the exercise. The other thing is, some people develop cramps. So to avoid cramps, you can soak your legs in warm water with little salt and then pedal your legs well. And especially in obese women, as the pregnancy grows, they can experience more cramps. So we ask them to keep a cushion stool at the same height as their sitting posture so that the cramps can be reduced. Similarly, when you lie down, we say turn to one side comfortably, and then you can, instead of fully stretching your legs, you flex your legs and then sleep with a pillow underneath your legs, so that in the popliteal fossa, that is the space behind the knee, there, then you will not have pain, you will not have pulling sensation. So when you exercise, take enough fluids. After exercise, relax. Similarly, your costume should be, depending on the weather change, wear light cotton clothing during summer and drink plenty of water, fruit juice, and as I told you, all fresh fruits are very good for you. Milk, yogurt, similarly green leafy vegetables. In non-veg, avoid deep fried foods, but you can take whatever you want to in soup form or boiled forms, you can take. Good walking is a must. That is why you may think why the weight gain is very important. Extreme increase in weight or non-gaining in weight or no weight gain at all, that is also bad. Over-gaining weight, that is also harmful. So balance your diet in such a way and your exercise. This goes a long way for your pregnancy. Now, the first 12 weeks are called the first trimester. Thereafterwards, it is the second trimester. But throughout the up to third trimester, till 40 weeks, whatever I am talking to you on exercises, this you can gradually do it. If you are not able to know on your own accord, you can take the help of your obstetrician, who may be guiding you to a person like a physiotherapist who will be teaching you how to relax during labor process. This is very, very important. Your mental relaxation is vital along with your physical relaxation. Then only you can feel that pregnancy is and delivery is a physiological phenomenon. In some people, we may restrict the exercise. For example, a person who has had recurrent abortions, they may have a condition called an opened cervical canal. We call it as cervical incompetence. Similarly, twin pregnancy. In these conditions, or where there is heart disease complicating pregnancy, all these cases, the obstetrician will be telling you to restrict certain activities which you have to follow. If you are otherwise normal, you should continue doing your exercise throughout the pregnancy. This prenatal care and postnatal care also, the exercise will continue. Similarly, other questions asked by women are the changes in the skin. This is called striae gravidorum. That is, due to the skin stretching, you develop linear marks. And this is also nowadays, how do I manage this? There are lotions available which can be applied on the skin gently before bath, and this helps in reducing the striae in pregnancy. And if you don't gain more weight, you don't develop more striae. So the avoidance of increase in weight a balanced gain in weight, care of your skin will help you to reduce the striae in pregnancy. Similarly, the breast. Preparation of the breast is very, very important. If you are going to be a good mother, your preparation of breast starts during the first trimester and ends during your delivery when you start ready for feeding. So keep the breast soft. You use lubricants like pure coconut oil or any cream. Soften the breast, and while having the bath, see that you see the nipples are kept soft. Indrawn nipples also as a problem. That is, normally the nipples point outwards, but in some cases the nipples are indrawn, which may be difficult for lactating mothers. But these days we have devices which help out in breastfeeding, so this should not be a problem. But you inspect your nipples. Your obstetrician will also guide you in how to take care of the breast. So the care of pregnancy is not a big problem. It is becoming a part of your routine. You eat well, you exercise well, and you enjoy your pregnancy. And the visits for obstetrician are timed in such a way so that in the early weeks, first 12 weeks, we ask you to come only once a month unless there is any problem. But in the second trimester, ultrasound is done, and then we do a repeat scan at 18 weeks along with what is called a triple test, that is to rule out anomalies and, most important, the syndrome called Down syndrome. So especially when now people are getting married late or they have conceived with difficulty, these patients require extra care. So they will be in what shall I say, the coordination between a trained sonologist and obstetrician with prenatal diagnosis of any abnormality, including the risk of Down syndrome or any other abnormality detected, because now the fetus can be treated as a patient. The anomalies can be identified, and then they talk together whether this is an anomaly which can be corrected and the pregnancy can go through safely, or in the small percentage of pregnancy, the anomalies are in so many that it will not be, what shall I say, we talk to the couple and say this is going to be a problem. This baby, when it comes out, it is going to have multiple anomalies and it may not be able to survive normally. So in these cases, we have to avoid continuation of the pregnancy and advise on termination. Previously, these anomalies were neglected till the late trimester, and lot of anomalies were during delivery. Certain conditions like decapitation and then removing the fetus by morcellation, all these things were done. But now with the ultrasound, the prenatal tests, along with the guidance by the astute obstetrician, who is your second mother in your life, is going to help you in seeing that your baby is growing well. And also, the visits during second trimester may vary from patient to patient. We don't say come once a month for a woman who is diabetic. If she is a diabetic, she is also consulted with the diabetologist. The diabetologist, with the obstetrician consultation, decides the sugar levels, the special diet. So all patients cannot have the same diet. The diets vary with women who have got heart disease complicating pregnancy or hypertension. Most important, we see some women developing suddenly blood pressure. So this is called hypertension complicating pregnancy, and then when it is combined with edema, that is puffiness of the face or swelling of the feet, and albumin in the urine, then it is an alert for that pregnancy. That patient cannot take a normal diet. She is advised special diet, special medication. So every patient is individualized during second trimester. If 80% of the patients are normal, 20% of the patients need extra care. So it is not that why my doctor is asking me to come frequently when my friend does not go. That is not the question or answer. Your question is, what is good for me is done by my obstetrician, who is my second mother, and she knows the best. That confidence level, once you develop, you are going to sail through the second trimester safely. In second trimester, you feel the movements. It is called quickening. It is like a bird underneath your hand. Quickening and immunization. Tetanus toxoid is given and biochemistry is repeated so that we try to know how is your anemia, whether you are becoming a diabetic or you have got hypoproteinemia, how is your cholesterol levels, your thyroid levels. So this is what is done in the second trimester, and you may be delighted to hear the fetal heart sounds with the fetal monitor, which your obstetrician will show you. So once you hear that, like the heartbeat, you get thrilled. I told you the ultrasound helps, the fetal monitor helps, the obstetrician is there to guide you, and you are the confident prenatal care mother. Prenatal care mother is a mother to become, she has got good prenatal care and she is sailing through the second trimester of pregnancy. We'll meet again of other exciting items in the second trimester, late as well as third trimester. Happy day for all of you. Enjoy this pregnancy. You sail through the pregnancy.